Alberta Premier Danielle Smith could end Canadian Medicare as we know it. With the controversial Bill 11, Danielle Smith's far-right government is effectively taking a wrecking ball to Canada's public healthcare system, replacing it instead with a two-tiered US-style system in Alberta. But Smith isn't working alone. Documents and lobbying records reviewed by The Breach show that private healthcare industry giants like Manulife, Canada Life, and Sun Life and their lobbyists are key partners of the Smith government. The UCP government even set up a working group of insurance industry insiders to oversee its changes to regulations. Meanwhile, doctors, healthcare workers, and the public have been shut out of the policy-making process. The lobbyist registry shows that there are at least 25 registered lobbyists for private insurance companies that are working directly with the Smith government. They've repeatedly met with the Smith government about healthcare innovation, which is the Smith government's favorite euphemism for privatization. Bill 11 was introduced at the end of December. Smith and her ministers sold the legislation as long overdue efforts to modernize healthcare and improve health outcomes, downplaying the sweeping changes it presents. First, it allows doctors to charge user fees for medically necessary services on a case-by-case basis, even if these services are supposed to be publicly insured. Second, insurers are now allowed to cover services that are usually covered free of charge under the public healthcare system, namely physician and hospital services. Bill 11 erodes the foundation of Canada's healthcare by encouraging wealthier patients to sign up for private health insurance so they can skip to the front of the line for surgeries and medical care. While Smith claims it will be limited to non-emergency procedures, industry insiders themselves have admitted it will open a Pandora's box of privatization that will spread to other medical services. If it is not stopped now, Alberta's two-tiered healthcare scheme could spread to other provinces, setting up a wave of privatizations across the country. Want to hear more? You can follow us for more bold journalism for transformation, and you can check out the full article at breachmedia.ca.